In Ontario, pharmacists can renew prescriptions. Here are 3 easy steps that you can follow. The first step is to assess that the patient needs the prescription for continuity of care. A good example would be Ramipril, prescribed for hypertension, but it could also include replacing a lost bottle of an antibiotic suspension. When deciding if a renewal is appropriate, your assessment should include the medical history, side effects, and missed doses. You should check if the patient is responding well. In the case of Ramipril, that would include taking a blood pressure and also ensuring they are not having any serious side effects. If you need a blood test to measure a serious side effect and you can't obtain that, then you shouldn't be providing a renewal. You also need to make sure you can access the information on the original prescription. If you don't have the original prescription at the pharmacy, you can call and get that information sent over. You can also use the patient's label. Once you've assessed the patient, the second step is to determine how long to renew the prescription for. Pharmacists can renew a prescription for either a 6-month supply or the total amount of the prescription, including all refills, whichever is less. Finally, the third step is to write it down. Start by writing down the renewal. Patients have the option to take the written prescription to another pharmacy. You do not need formal consent to provide a renewal. You also need to notify the prescriber anytime you renew a prescription. And finally, you should keep a record of the encounter. You need to document your assessment with information such as the blood pressure measurements or side effects, the information from the original prescription, and your rationale for the length of the renewal you provided.